has the first week of school gone for Thrall ISD and the schools on campus?
Okay, well, we made it through the first week into week 2, and things have gone really solid. We have had a good protocol in place. We've had a lot of planning that went into, as we've discussed previously, coming out of the summer, and it's been pretty much off to the races. It's been a good start. We did have, as you alluded to, on Monday, we had the August the 17th. We did actually have our first confirmed positive case of a faculty member, and currently, in addition to that, of course, for keeping safety and being extra. Taking the extra precautionary measure, and she is this individual is actually quarantined by medical professional advice, and then we have one additional adult who is in isolation, and that is precautionary, and one student who is also isolated, and that is just to they're not positive cases. Those are just in the protocol. It's what we're asking for.
Are those 2 extra cases? The student obviously goes to Thrall ISD, and then is that a faculty member or staff member that's also in isolation? So 2 adults and one child in isolation right now.
That is correct. And reason for an isolation case like this taking place, which so many others are learning about just as we are, is the part that TEA and CDC and everyone talks about as far as that close contact definition. And so both of these people, the student and teacher in isolation, are people who would have been a part of that definition of being in close contact.
What's the policy for reporting this and contact tracing as well when you hear about a positive case in your district?
Sure. Well, that's a loaded question. It begins with the staff member, the parent, the student, whomever it is, actually taking the initiative to share with us that that they're not the symptoms are actually showing up. Our district nurse and COVID-19 safety team is readily available to the campuses and to all staff pretty much immediately. And so we're kind of almost sitting back and waiting for these situations when this happens. And so this first one, it did happen so quickly, and that employee had not been here since last week. So it happened on Monday. They did not come on Monday morning. So there was a weekend, which helps out. And then obviously today is a virtual day for our district. And so this works out nicely, that it just gives us that extra time to go in and do the deep cleaning, to follow protocol, and do all of those things. The contact tracing takes quite a bit of time. It's very easy to take example A and say, hey, you have all these symptoms, you need to go get tested. They go get tested, they bring the test back, and pretty quickly it says they tested positive. What's most difficult to us is this contact tracing and following your protocol and making a guesstimation or a good reason for why you would like to go ahead and isolate someone and get their agreement to isolate, because it's not real straightforward.
As far as the teacher, had she been on campus? Had she been around any other teachers? Any worries there?
We have done a good job across the district for all staff to wear the mask, keep the social distance. They even do the part where there's increased hand washing in each of those items. But in her situation, this was one where having tested positive, we had to look back to see if any of that protocol may have been somewhat relaxed for any reason. And in the situation where we actually had another employee and student isolated was because they came within that 6 feet, and we felt like that protection was breached. Not in an unprofessional way, just that we don't feel safe that we can say that for sure, that space and the integrity of it, didn't get breached.
Was that employee though in the middle school, walking around on campus anywhere?
Right. They are actually a shared campuses, and also with what they do, they actually go to multiple classrooms, which is actually going to allow us to look back at protocol again and see if perhaps we can't eliminate more of the situations where some of the grouping and the sorting, so to speak, couldn't be taking place even more so throughout the district.
So basically, the teacher and then the other employee and student were not inside the school, or I mean, they had been inside the school, but before school started.
A teacher. This employee had been inside the classroom. It was actually inside the classroom.
Other teachers, I guess, have they gone through the safety protocol? Anybody else that's self-isolating right now, or besides those 3 individuals?
No, that we are fortunate that we're there, but as we continue, the journey of being in person, and as we have students in person 4 out of the 5 days, we stand the chance to be able to be having more conversations about this, and hopefully not many cases, but we will just have to, not only day to day, but hour to hour, we'll be monitoring and having conversations over it as administrative staff and with the safety team.
What's the notification process like for the district? From my understanding, I guess a letter went out just to the middle school parents. Is that correct?
Letter went to middle school parents and elementary school parents, because it was actually this employee actually goes between the 2 campuses. And so we notified each of those staff members and parents. And in probably some of this that I saw on the news yesterday was pointing to the high school did not get notification, and that's because it in no way was a concern as far as what TEA requires and with what is required with us notifying parents. One might think, well, it'd be good just to, we're a small district, we're a small community, just send a letter out to everyone. But then what you end up doing in that situation is you send a sense of worry to a group of students and faculty and maybe even parents who, really were not affected by doing that. So,
no worries even with, maybe a middle schooler with a sibling at the high school that,
all of that gets looked at in contact tracing. This did not happen, but had we had a situation where a middle school student tested positive and we knew they were living in a home where they had a high school sibling and an elementary sibling, then that would be a little bit more magnified situation. And so through contact tracing, that was not the case in this situation here with this employee. But yes, there will be some situations where if in contact tracing, the safety team determines that that is the case, that each of these would be first line, then we would have to go on the medical advice of quarantining each first line person.
From my understanding, the contact tracing can take some time, with some of these backups. Is there any concern with that student might have had contact with other students outside of the school system? And if so, how have they been notified?
Correct. I really wouldn't be able to answer all of that question without it being possibly inaccurate. But I will say that hours of contact tracing has gone in, and the district nurse or some member of that safety team who has done an amazing job in the contact tracing, talking with Wilco, trying to just make sure that, that no leaf is left unturned, so to speak. They have talked to or spoken to everyone that we felt needed to be communicated with.
As we discussed before the school started, this was always a possibility that someone could come into contact. What's the plan moving forward to monitor this? I mean, does this kind of show the reality of going back to school in person during this time, that COVID positive cases could come up?
Well, that's obviously the reality. It's it's just like going to the grocery store, and we use that example for for our people when we come back in person. Do we choose to pick up groceries curbside, which is a little bit more like the virtual aspect, and try not to go into the store, and just kind of leave it up to the employees, which our local grocery store does a great job, and I don't know of any complaints, but I think it's real important for us to keep in mind that when you do curbside, you don't get to go pick out all the flavors and get all the extracurricular that goes along with it. But if you decide to put your mask on, which is required, and go into the local grocery store and kind of go for a stroll and pick out what you need to, that's a little bit more like the in-person learning. So you're going to risk more of a chance of possibly picking up and having some, spread. So I don't know any other way to put it other than in-person is definitely risky. But I will say I had an outpour of community members that, it's just amazing to hear from them to say that this is what we want. This is what we feel our kids need and they like at the pace that we're going at it. And our administration have been just wonderful. We had a high school volleyball game last night. We don't allow the visiting team to come. By allowing the visiting team does get to come. The visiting parents and community don't get to come because we want to eliminate the spread. But our folks who are on the home side that do get to come, they have to come through the full screening. They do the temperature check. They have to wear the mask in the gym. And I did not have to correct one person. They realize that if they're going to be here supporting our students, then we're going to all follow protocol. And if you can't follow protocol, you can't be here. You can go and deal with it virtually. And that's the safer route as far as that goes.
In terms of reporting as well, do you have to report to the state or any local health departments that you do have a positive case?
Yes, requirement is for us to for sure report for us it's Williamson County Health Department, and I will tell you, they and our district nurse especially, but now some of our other staff, they have gotten to know Williamson County the health department very well. They work with us hand in hand, and so while we're working with them, we're essentially reporting. They know what's going on, and there's been situations where we have made some determinations and we talk, and a day later the conversation continues and we monitor the situation. And we've even made I don't have some situations to allude to, but we have made situations that I'm thinking of that were changes that that they guided us on, and we feel comfortable having their guidance. And we do feel that if it needs to require a physician or a doctor who has the training, then either Wilco or our school nurse will pull. And that's what's happened with the positive case. We've been dealing with the physician for that individual.